So for our introductions, hello, my name is Michelle. I'm the dental programs manager at Niagara College. I oversee the dental assisting, level 1, level 2, dental hygiene, and dental office administration programs. So with us today, we have Heather Churchill. She is a clinical registered dental hygienist, as well as a faculty in our dental hygiene and dental assisting programs. Jennifer Carney is a level 2 dental assistant. She is our dental assistant faculty. Yvonne Corin, she is our dental placement coordinator. She's also a level 2 dental assistant, so she takes care of all our placements. Hi, Yvonne, I can't see you now. You disappeared on my band. Heidi Lambrix is a dental technician. She is a level 2 dental assistant. She works in our clinic and oversees the clinical aspects. She basically, her and another full-time dental technician take care of the clinic for us and make sure everything's running smoothly all day long. Elena Gauthier is a registered dental hygienist. She is our dental hygiene faculty. And then of course we have Gemma. Gemma Flynn is a senior dental hygiene student. She's been with us since September 2019, I want to say. Is that correct, Gemma? Yeah, so she's been with us for a few terms now. She's survived the COVID cohort, we're going to call it.
Yeah.
Yeah, so that is our staff and our students who've joined us today for the Spring Open House. So welcome to Niagara College, Spring Open House. So at Niagara College, we offer 3 dental programs. We have dental office administration, dental assisting, and dental hygiene. So program learning outcomes. So Niagara College strives to ensure that our graduates are employable in their field of study, able to succeed in employment through the ability to continuously learn, and are responsible citizens. Therefore, each program of study will endeavor to provide students with the skills needed in their specific field of study, encompassing vocational skills, essential employability skills, and general education. So computer technology requirements. So this is very important, especially at this point, because we are doing a lot of remote learning. So in order to successfully complete studies at Niagara College, it is recommended that each student have access to a personal computer or laptop. Niagara College Open Access Labs offer computers on campus, but availability cannot be guaranteed. And some program softwares may not be available on open access computers. And right now we have very limited open access due to the COVID restrictions. So Nathan, I'm not sure if you can speak to that for September. I know that in the fall, there may be some changes, like you said at the beginning. So that will be updated as we know more.
Yes. So just as Michelle said, definitely it's going to be a lot more health restrictions on all the different procedures that are placed. One thing I would definitely say to keep checking the Niagara College /COVID-19 webpage, just because it gives you all the updates regarding each semester, what each program is going to look like, which each course is going to look like as well. So we make sure we break it down very, very in limited terms, so there's no communication. So please check and utilize that tool on niagaracollege.ca/COVID-19 underneath the updated terms, and then you click the selected term that you would like to know more about, and then you're able to see the program, courses, and so forth.
Okay, so selection and ranking. So this is specific to dental assisting and dental hygiene. So these 2 programs are competitive. So this means the number of qualified applicants exceeds the available places. So selection will be based on the most senior level final grade available in required courses at the time of ranking. So midterm grades are not used for ranking purposes. There's also testing and other supplemental evaluation that may be required with these 2 programs. So selection and ranking. So we're going to start with the dental office administration program. So applications for the DOA program are evaluated based on published admission requirements. So when the applicant provides proof of meeting the requirements, an offer of admission will be issued, provided space is available in the program. In the event that the number of qualified applicants exceeds the available places, selection will be based on the most senior level final grade available in required courses at the time of ranking. Again, midterm grades are not used for ranking purposes, and testing or other supplemental evaluation may be required. So our dental office administration program. So are you a people person seeking a career where you can blend your aptitude for business with your interest in oral health care? So as a dental office administrator, you oversee the daily operations of a dental office, including patient care records, health insurance company claims, and appointment scheduling, among other things. That is just the tip of the iceberg when it comes to dental office administration. So you can go to next. Thank you. So this is a 1-year program. It's 2 terms, which is 28 weeks. There's 14 weeks for the fall term and 14 weeks in the winter term. It goes September to April. The admission requirements for the dental office administration program is English, any grade 12 or equivalent. Recommended courses are computer and information science grade 11, introduction to accounting grade 11, information technology applications in business grade 11, or mathematics any grade 11. So it's, as long as you have English, then you can apply for that program. So some highlights of the program. So applied learning opportunities through a real world teaching environment located at Niagara College state-of-the-art fully operational dental clinic. There's over 140 hours of hands-on field placement experience at a dental office. Excellent program reputation among community employers. Graduates are eligible to write the certification examination for dental receptionists through the ODAA, which is the Ontario Dental Assistants Association. Career opportunities. So as a dental office administrator, you could be clerical staff in a dental public health department, customer service representative in a dental office or insurance company, a dental office administrator, and receptionist. There's other positions as well that aren't listed there, such as treatment coordinator, manager of an office. So the list goes on, but those are basically the entry positions that you would get once graduating from our program. Okay, so we're going to move on to the dental assisting and dental hygiene program requirements. So with these 2 programs, you need a CDS. This is a communicable disease surveillance. So this is a confidential form that must be completed and submitted to Student Health Services 2 months prior to the start of the program. So both programs begin in September, the beginning of September, right after Labor Day. And those 2 start dates, you are going into clinic right from the day you start. So this is why it's so important for the CDS to be in. So it has to be in at the beginning of July. Okay, so this form and checklist can be viewed at niagaracollege.ca/CDS form/. So this is, if it's not completed, you will not be able to attend your pre-clinic. And like I said, that begins at the first day of school. So it's very important if you're interested in these 2 programs, if you've applied, that you look into this form to make sure that you have started. You can't start getting it done in July. It has to be submitted in July. So you need to start now if you've applied to the program. CPR, BLS, or healthcare provider. So this is your current standard first aid certification and cardiopulmonary resuscitation level HCP with AED certification is required. So CPR, basic life support, you might see BLS, or HCP, healthcare provider. Depending on the company, you might see a different acronym. So you always want to make sure you're checking to make sure you have the correct one. And it also has to have the AED certification, and this must be renewed annually. So if you do it now, then you'll have to renew it next year at the same time. Okay, so make sure that you're up to date with your expiry dates. All certifications must be met and remain current, or placement in clinical will be denied and the student will be withdrawn from the current placement or clinical. So it's very important that this remains up to date and you get it before you start school. Criminal record check. So this is important as well. So a criminal record check with vulnerable sector screening, the acronym is CRC-VSS, needs to be done for the beginning of the program, but it needs to be less than 6 months old. So you have to make sure you're arranging that in time to be 6 months from the beginning of the program. So many employers have instituted this requirement for appropriate field placements. All right, so we'll start with our dental assisting program. So these are the requirements for a dental assisting program and the overview of the program. So do you have an aptitude for meticulous work and the desire to be part of the integrated healthcare team that provides oral care to individuals of all ages? If you are, then as a dental assistant, you would play a role in a dental practice and have the knowledge and practical skills needed to help patients achieve their oral health goals. So a dental assisting program is a 1-year program with 2 terms. The first term is September to December. It's 14 weeks, and the second term is 18 weeks. So it's an extended second term. So you won't be done this program until the end of May. So with this, there's a level 1 and level 2 skills that are learned. There's pre-clinic, radiography, dental science, and dental materials, as well as restorative clinic. And I need to add as well, there's a preventive clinic as well that I failed to add in this slide. So the admission requirements are English, grade 12, mathematics, any grade 11 or equivalent, biology, grade 11 or grade 12, chemistry, grade 11 or grade 12, or physics, grade 11 or grade 12. So with dental assisting, the highlights of this program, so there's over 400 hours of hands-on experiential learning in Niagara College's state-of-the-art, fully operational dental clinic and labs. So this is a unique interprofessional education experience in both classroom and clinical environments. So as a dental assistant, you're going to gain practical experience in a dental office field placement and combine theory with real world experience. This is an accredited program with the Commission of Dental Accreditation of Canada, and graduates are eligible to write the Entry to Practice National Dental Assisting Examination Board exam, followed by certification by the ODAA, which is the Ontario Dental Assistants Association, after successful completion of the board exam. And that is the board exam does come at a cost to you. So there is a cost involved that is not part of your tuition. Career opportunities as a dental assistant, there's several. There's community dental health, dental supply practice, education, general dental practice, insurance company, product research, sales, specialty dental practice, just to name a few. All right, so dental hygiene. So do you recognize the value of a healthy smile and want to play an important role in oral health care delivery? As a dental hygienist, you are well equipped to provide oral health education and excellent patient care in a clinical practice setting. So our dental hygiene, so these are the requirements. So this is a 3-year advanced diploma. So this means that you will be completed you'll complete a dental hygiene advanced diploma, but you will do it, it's a 3-year program, you will do it in 2 years. So there's 6 consecutive terms. You will begin in September and you will go through the summer. So your terms go consecutively. September, you have a fall term, a winter term, and a spring term, and then a fall, winter, and spring. Okay, so with that, you do get weeks off in between. You don't go straight through. So it's very similar to the other 2 programs where you'll have a 14-week term, and then you have 1 or 2 weeks off, and then you start the next term. The admission requirements for this are an Ontario secondary school diploma or equivalent, including the following required courses. So again, English, any grade 12 or equivalent, math, any grade 11 or equivalent, biology, grade 11 or grade 12, chemistry, grade 11 or grade 12, and physics, grade 11 or grade 12. Pre-admission requirements. So with this one, you have to do the pre-admission testing, which is the completion of the health occupations aptitude exam. So the program highlights for dental hygiene include a graduate from a 3-year program in 24 months with a unique 6-term program delivery, exceptional preclinical practice and clinical opportunities in Niagara College's state-of-the-art fully operational dental clinic, unique interprofessional education opportunities as part of an allied health team, access hands-on learning opportunities through comprehensive and varied placement experiences. We are accredited by the Commission of Dental Accreditation of Canada, and graduates are eligible to complete the Entry to Practice National Dental Hygiene Certification Board exam, and then be eligible, once successful on the NDHCE, to register with the CDHO, which is the College of Dental Hygienists of Ontario, to actually practice dental hygiene in Ontario. So career opportunities. So again, you're going to be, you can have a job in a community health setting, a dental research facility, educational institution, general dental practice, hospital dental facility, independent dental hygiene practice, long-term care facility, specialty dental practice, and those are just a few. Okay, so we're going to go back to the pre-admission requirements because I feel this is very important for you to understand and to note before you embark on your journey to Niagara College. Okay, so if you apply to the dental hygiene or dental assisting program, you must begin to complete the documentation requirements as soon as you are accepted into the program. This also includes if you're on the wait list. If you are on a wait list for the program, it's important for you to complete your documentation requirements. If you are on the wait list and somebody backs out and doesn't take their spot and they call you and you do not have these requirements done, then they will go to the next person on the wait list. Okay, it's very strict. So if you are on the wait list, make sure you get your documentation as well. These documents are due at the beginning of July. It's necessary to submit them by the due date to ensure that they are processed in time to begin the school year. These documents will not be accepted on the first day of school because clinic starts on the first day of school. If you do not have your documentation, you cannot begin school. So by not submitting the documents on time, you risk being exited from the program. So it's very important that you make sure that you take a look at this and fill out the forms and have the submission by July. So if you are accepted into the program, please make sure to access the CDS form within your online MyNC account under My Documents. So a physician will have to complete the portions of this form. So your family physician or local clinic can help you with this. So once completed and submitted, your CDS form, that's your medical form, will be processed and your CDS compliance email will be sent to your student email account. This email signifies that you have met the health compliance requirement for your program. You will not be able to choose a timetable until your forms are submitted and processed.
How is the clinic looking? Is it still open?
So that's a good question. We are currently in clinic doing our clinics and labs. So if you, in this program, because there are half of your, you have theory courses as well as clinic and lab courses. So it's a hands-on course, especially even the dental office administrators are coming into the clinic to work in our reception area, doing rotations there as well. So our dental assistants are currently finishing up their winter term. So they are doing radiography, dental materials, and pre-clinic as well with the level 2 skills, as well as restorative clinic right now. So some of them are on campus 4 days a week. Yeah, so it's a very busy term for our dental assistants. Our dental hygiene students, we have 2 cohorts right now. So we have our dental hygiene junior students who are just finishing up their 2nd term, and we also have our dental hygiene senior students who are finishing up their 5th term. So the dental hygiene junior students are currently finishing their radiography components in their labs, and they're finishing up their pre-clinic skills in clinic right now with their dental hygiene instructors. So right now they're just going through, they're finalizing all the skills that they need to learn before they begin their client care. So they're right now still learning all the instrumentation skills and any other skills. So they're doing, impressions, polishing teeth, ultrasonics, air polishing, whitening, denture cleaning. They're doing everything right now to prepare for the beginning of their client care clinics, which will start in May. Our dental hygiene senior students are in their 5th term. So they are actually in client care right now. So they've completed all the requirements to take radiographs, for instance. So they're in the middle of client care clinics right now. And that's what they're doing on campus. And the rest of their courses are on theory. So we have full clinics running right now every day, whether it's a pre-clinic, whether it's a client care clinic, or like I said, even our dental office administration students are coming in to do clinical rotation. So they will come in when we have client care clinics and process the clients coming in, because there is a fee associated with our client care clinics. It's not a lot, but there is a fee associated with it. So they are doing any processing of those and learning how we run our dental clinic as far as, appointment planning, scheduling, front desk duties, insurance, all the fun stuff. So they're there as well.
Well, I was just about to say, the questions just came rolling in. So
Okay.
I'm going to start.
All right. You got to shut me down sometimes. I don't stop.
No, that's okay. They all popped in around the same time. So one of the questions is that they want to know what the schedule is going to kind of look like for them.
Specifically who?
For dental hygiene.
Okay. Elena, did you want to take that? Because you have your dental hygiene junior faculty here.
Sure. Hi, everyone. So dental hygiene times, I think it's the first one we're looking at, right? From Sarah. So hi,
Yes.
Sarah. So in pre-clinic takes up a lot of your time as a first year student and for dental hygiene. And so you have 8 hours a week of pre-clinic in term 1 and 2, so fall and winter term. And then you also have, oh God, off the top of my head, there's about 8 courses that you do take as well. So it is very very full-time. I know Gemma can probably attest to that too as a student. It's very full-time. As of right now, I know I saw another question about whether or not classes will be online, I think. So we don't know fully right now what that's going to look like. So I can't really answer that question either for you. But your preclinical sessions, that 8 hours a week, will be on campus. And your radiography labs, which Michelle, that's 2 hours a week, right? Rad lab, that will be on campus as well. So definitely you're going to be at least 10 hours on campus. And then the remainder is 7 or 8 courses that are about 2 hours each, either online or on campus. So it's be prepared to be busy for sure. It takes up a lot of your time, but it's fun.
Gemma, did you want to speak to what it's like in a first term? Maybe you could give a little bit of insight into a first term.
Yeah, sure, I can.
Okay.
It might be a bit different to what will happen in the fall, because my first term was and half of the second term was in person. So just basing it off of that, it was a lot. So you basically would have, like, I think it was clinic 2 or 3 times a week, and they were like 2 hours each. And then either before or after your clinic time, you would have class or you wouldn't, and you would just kind of hang out either on campus or off campus. The homework, kind of like the homework assignment aspect of it, it's a lot. They do give you a lot of weekly assignments and weekly things to do, but it's really good if you just like stay on top of it. That's what everyone says in this program. You have to have a pretty good basis of just like time management and being able to keep yourself organized. I recommend a wall planner that shows the month. It's really helpful.
Yes.
So
Definitely.
Thank you, Gemma.
no problem.
Well, I was just going to say, also, I just inputted a link in the chat. So with that link there, it will take you to the COVID-19 update page. And there's a little section or a tab on that link that's called Update by Terms. So right now, you can only find winter and spring of 2021 there. However, fall information will be released again around May. So please check that link to see exactly which courses is going to be online, which courses is not going to be online, which courses are going to be hybrid, which courses are going to be synchronous and non-synchronous. So please, that link is very, very important to understand which courses are going to be in person and which courses are not going to be in person, and how the program is going to be delivered moving forward for that semester. That information will be released again in May. We have another question here. Well, if you want, I think Gemma could answer this too. Someone wants to know, what is a week look like of school? Like, how busy is it? How is it up and down? Is it more in class? Things like that.
So coming from just like a first semester kind of a experience, it was pretty manageable. I'm not gonna lie, it wasn't horrifying. It's a lot different than high school. You do have a lot more work and assignments because you do have double the course load in comparison to high school. But you know what? It's still kind of left you with time. If you really like planned out your day, you were able to get your assignments done, do this a different day, and then still kind of have like a weekend to yourself as long as you kind of planned. It's very busy, but it's manageable busy. Ask me about senior dental hygiene. Very, very busy, but you can still kind of manage it. It's fine. It's just a lot of work.
Okay, and thank you. Someone wants to know the cost of textbooks. It varies. We usually expect students to save around, say, $500 to $800, depending on the program, for textbooks per year. I don't know if you guys want to add on to that.
Yeah, I think, Gemma, do you remember what it cost you for the first year for your textbooks? Because that would be your biggest year, because the textbooks you buy in your first year, you actually will use for year 2. Not all of them, but there's 2 or 3 or 4, I believe. Mm-hmm. There's your Darby, your clinical dental hygiene, your Wilkins, and your assessments and your instrumentation. Those 4 will carry you through. Yeah, they're probably the most expensive. Do you remember what you paid for the first year?
I'm going to say around 600 or 700,
Okay.
I think, about that. But the good thing is that, like, at least when you get into the later semesters, not every class requires a textbook, and you don't always need to get the specific textbook for the courses. Your first like semester, like first 2 semesters, you really need to get the textbooks that are there because they're kind of like the foundations of how to be a dental hygienist. So they're important.
Okay. One question came and said, is it better to do the dental assisting program before doing the dental hygiene program?
I'm a dental assistant who became a dental assistant first and then went into hygiene. And I will always advocate for being a dental assistant first, because I feel like you do have a certain, you get a basis of the way an office is run and the duties, but you don't have to be. But it definitely is an asset to have it. I mean, I think Heather's on the call. Heather can attest to this as well. She's also a dental assistant who became a dental hygienist, and it makes things a lot easier when you're in dental hygiene, because first of all, you would get exempted from radiography if you took it close enough. If you were a dental assistant and it's within a certain time frame, you would get exempted from the radiography that you would have to take in dental hygiene. You would get exempted from the dental materials that you have to take later on in dental hygiene. So there is, and then you know all the anatomy already, you know the basics, you know the dental sciences to a certain extent. You have a basis for pharmacology, for local anesthetic. There are many things that you learn in dental assisting that overlap into hygiene, that in dental hygiene you may be going into further extent and you're getting more of a bigger education about certain topics and theory courses, but to have that basis makes it a lot easier when you're in the program for dental hygiene. It doesn't mean you're not going to be able to succeed in dental hygiene without being a dental assistant, but I definitely believe it's an asset.
So I'm just answering a question on the typing.
Oh, there's Heather.
Yeah, so the background of dental assisting, it does, like Michelle said, it gets you exempted from a couple of the courses. It also gives you the background information of the tooth numbers, the anatomy. You're maybe a little bit more comfortable not having to learn sort of all of that new lingo and stuff at the beginning of the term, but we had no choice. That was the way it was back in those days, right? We had to be a dental assistant first and then apply back for dental hygiene. And now over the course of time it's changed of the direct entry.
I think too, for client care, I believe that as when you go into your client care clinics as a dental hygienist and not having the dental assistant background, you're a little bit more anxious and nervous about seeing somebody for the first time. As a dental assistant, you've already seen them, you've already gone through restorative procedures, and just having that knowledge as well of restorative procedures before going into dental hygiene is an asset, because you know what you're looking at when you look at somebody's mouth, whether they have implants or crowns, if a tooth has been root canaled, you know all that stuff already, as opposed to learning it when you're in the dental hygiene program and just seeing it maybe for the first time. If anybody has anything to add, I don't know. I don't want to feel like
Well, I
I'm
was just
talking too
about to
much.
say, I have a few more questions.
Okay.
So one student is graduating from high school and they received a conditional acceptance, and they just want to know what that actually means, if anyone can talk to that.
Yeah, so I got that from a different college, a conditional acceptance, and it's basically based off of your grades at what you've shown at that current point. Your acceptance is conditional provided they don't drop. So they kind of have to stay at about where they are now when you've applied, or else if it drops below, then the acceptance can get revoked. So it's keep up the really hard work that you're doing. So
Heather, did you have something to add?
No, I think that's, Gemma explained that well. That's how I understand it as well.
I understood it. Yes, I feel like that too, but I wasn't under the impression that we had conditional acceptances into dental assisting. So I think I'm just a little confused, but something I would need to clarify for my own knowledge as well. So I'm glad this came up.
You wouldn't have the final grade submitted until the end of your semester. So it was based on your midterm grade, assuming that you would have the same grade or better by the time you graduate, right?
So I was just about to say another thing that came up. I wanted to confirm, is the CPR a healthcare provider, or is it the adult, child, and infant?
No, it's healthcare provider or basic life support. Where's Yvonne? Yvonne's my placement coordinator. She's so
Hi.
they keep changing the acronyms on us. So but
Mhm.
it's
Yeah.
basic life support now. Is that what we're looking at, Yvonne? And it has to
Yeah,
be a
so,
hands-on component
Yeah,
as
it
well.
depends. It depends on who you go to. Like I said, if you're going to be seeing, or if you're going to be going to like a Red Cross or a St. John's, you're probably going to find it's going to say first aid CPRC. And then there's an additional component to it, and it'll be your BLS. You may see instead of BLS, it may say HCP. So it just depends on what provider you're going to use. They're both the same. So if you see something that says HCP, that's what you need. If you see something that says BLS, that's also what you need. They're just transitioning right now. So it just depends on, like I said, the provider you're going to use.
And it has to be a
Okay.
hands-on component as well. It can't be online.
Right.
Yes, and I also wanted to say too as well, if anyone's looking to receive that, as Yvonne mentioned, there's a few places to go, St. John's and Red Cross, as well as Niagara College do offer the class as well. So just wanted to put that out there.
Sorry, Nathan, did you just say that the Niagara College is offering CPR?
Yeah, we offer standard first aid, CPR, AED, and HCP, healthcare provider.
Okay,
So,
do you know the dates for that by any chance?
no, not yet.
Okay.
So I believe the part-time studies office will have all that information because they don't have it online right now. However, I think they're not releasing that as of yet. I think it's going to be updated coming up very soon, probably in the May time.
Yeah, so I think just to further that, just to answer more about that, if you are having trouble getting into one, then you need to contact Yvonne or myself to let us know, and maybe we can help you find one. Try and do your research though to get into one, but I know with COVID, it was a little bit, it was a tough go for a while because they were canceling all the hands-on classes, but they're back in full swing now, right, Yvonne?
Yes. There was something new. I was just speaking to a provider, and what they may do is some of them are offering just the first aid online. It's going to be offered over a Saturday and Sunday, but you have to still go. Like, we don't accept online CPR, but what they're doing is they're doing something that's called blended. So you may have a portion that you may just do on a weekend at home, and then you have to go in to complete your CPR and your BLS. So, but that has to be completed in a facility. We don't accept any of the CPR, BLS, or CPR, HCP online.
Okay, and I just wanted to confirm for me too. If you don't mind just confirming whether you're domestic or international, as your question is just asking what's covered underneath the ancillary fee, and it's different for international. Well, it's not different for internationals and domestic. However, I want to make sure I give you the accurate information because it's going to include also the tuition as well. So it's not going to just be one separate page where you could just see the ancillary fees and separate page for tuition. They come together. So I just need to know if you're international or domestic, then I'll be able to give that to you. With that being said, I'll send you the link for that information. Whilst I'm grabbing the link, there was another question that came through for the dental program. They want to know what percentage of students come from dental assistant and the dental hygiene program.
So I think Elena, do we have, I think Elena's on the call right now in our dental hygiene program. I would say there's maybe, I would say 12 students who are dental assistants out of 55. Is that correct? Do you think that's kind of a good?
I would say more than that,
Yeah.
because there's like at least 10 who graduated from DA last year about that, but then there are a bunch who were DAs from another school or who
Okay.
graduated like 3+ years ago from DA. So
Okay.
we have a pretty high number of DAs actually, and that was different from last year. Last year's group didn't have as many. So it
Oh, you're right.
varies.
So
Yeah, it varies every year.
yeah, so so Nathan, I guess we can't give you a percentage of what.
Okay.
I can tell you that every year they save at least 3 spots. They
Okay.
save at least 3 spots in the dental hygiene program for dental assistants who are in the current dental assisting program at Niagara College. So if you want to go into dental hygiene and you're in the dental assisting program right now, then there are spots that are saved for the, so basically they still have to write the entry test, but they go by their grades. Jen, I don't know if you can answer this. Do you know how many? Was there 3 that were accepted for sure, or is there more than that?
I think there is a few more than that. I think there's a few more than 3 that have been accepted, but I'm not 100% sure. Heather, do you know how many might be going in next year?
Sorry, Heather, you're on mute.
My dogs are barking, so I think the 3 for sure, and then there's several on wait list, and a couple
Yeah.
are like way down on the wait list.
Okay, so they always reserve at least three spots for the highest ranking dental assistants in our program. It's not a dental assisting program from another college, it's at Niagara College. So there's always 3 reserved, but it doesn't mean that you're not going to get in. So last year, like we said, we had, did you say we had 10, Elena, from last year that got into the dental hygiene program?
There's 8 to 10. There's quite a few of them. Yeah.
Yeah, and I'll tell you why they got in, because they had all their CDS forms completed and they had all their CPR and they had their VSSs done. They were ready to go. So I had students contacting me in September. It was beginning of September. We started a little later this past year in 2020 because of the way Labor Day felt. So I believe it was September 7th or 8th that we started. So I had some students contacting me, September 1st, September 2nd, who were dental assistants from the previous year, who told me, I'm number 16 on the waiting list. Do you think I'm going to get in? And they ended up getting in, because what happened was they started going down the list on the wait list. And as soon as they asked, do you have your documentation? Do you have your CDS completed, submitted? No, I don't. No, I don't. So the ones who are on the wait list, who are at the top of the list, actually did not even get an opportunity to accept a position because they didn't have their documentation complete. So it's so important that you get that documentation submitted and ready to go. Because at that point, when those hygienists or those assistants who are on the waiting list, they had everything in a package. All we had to do was give it to health services. They cleared them within a day. They were in class the next day. So it's very important to make sure you have it submitted. And because even if you have it done and you bring it, that's why we say you can't bring it on the first day, because if you bring it the first day and there's something missing, or there's something that needs, more blood work, say maybe you got a Hep B and it was too long ago and you need a booster, something like that, that will prevent you from starting school. So that's why we ask you to submit it beginning of July so it can get processed, because if there's anything that's missing, you have time to get it. If you don't, then you might not, and you do get it first day of school, like we said, it's not the time to be submitting it. You have to submit it beginning of July. I cannot stress that enough. Okay, I'm going to stop now. Thanks.
No problem. I was just about to say, everyone seems to be very on it today, so I'm happy. We have a few more questions. One is, after completing the NDHCB exam, what other countries can they practice in? Can anyone answer that?
I'm typing that out right now, but I'll answer it live. That's okay. I was going to tell Adriana, it all depends on the country you're looking at. Each country has their own requirements. If you go to the website for the International Federation of Dental Hygiene, that website will explain to you what every country needs. So each country will have their own board exam, potentially. Each country will have their own education requirement. And a lot of times these exams and education requirements are transferable, but not necessarily. There's some countries that require you to speak a certain language. So it's all on that website, the International Federation of Dental Hygiene, if you're looking at a specific country.
Okay. Well, I was just supposed to say there's another question that's very interesting. Some students want to know, for the first aid and CPR, is it not due 2 months before, or is it due 2 months before classes start?
So the CDS, maybe Yvonne, do you want to take this one? This is your thing. I feel like I'm talking too much.
So, like Michelle said, we can't stress enough. If you end up getting the letter, or if you choose to come to Niagara College and you get the welcome letter, make sure you read through it thoroughly. There's going to be some dates on there that you're going to have to follow. The CDS documentation, like Michelle said, is going to have to be due at the beginning of July. Okay, the actual date is going to be July 9th. So that has to be submitted to Student Health Services. It's going to have to be mailed to them, or it's going to have to be brought in to the college and put in the drop box. Your CPR will have to be submitted by August 5th. That is going to be the due date for everything to be in. So that's where you're going to be sending me your email to say that you've been cleared. Your CDS has been cleared. That's when you're going to be sending me your VSS, and that's when you're going to be sending me your CPR. Okay, so you will have time to get your CPR throughout the summer, but the date that is going to have to kind of be in your brain is August 5th. That is the day that everything is going to have to be submitted, because like Michelle said, if it's not submitted, you aren't able to pick your timetable.
And just to be clear, when she's talking about submitted, she's talking the CDS submitted that you've been cleared, not
Yeah.
the submitted CDS form. The submitted CDS form needs to be in, that's filled out by your physician by July 9th. That goes to Health Services. Health Services are responsible for looking it over and making sure that you've met all the criteria. Once you get that email that says you've been cleared by Health Services, you send that with your CPR and your VSS to Yvonne by August 5th.
And also, just to let you know, the Health Services Department, you know, they're very busy. They're going to be getting, there's all different programs that, you know, have to be cleared as well. So, you know, you're going to submit it to them by July 9th. And the reason we want it done by then is because it could take them 3 to 4 weeks to process it, because there's a lot that needs to be processed. So, you know, you can't be a week late, because if you don't have it submitted, or if they don't get to it on time, then you're going to end up, you know, you're not going to be cleared. So the date will be July 9th, and it will have to be sent to them. And another thing I just want to say, when you go to your doctors and you bring this form to them, I would just mention to them that, you know, this form has to be done, and just, you know, make sure that they look over the form, because you know, sometimes we end up getting students coming back and something was missed, and, you know, and then they're running around trying to get things done. So just when you go into your doctor, just let them know that, you know, this needs to be filled out for your program. And if it's not filled out correctly, then, you know, you may not be accepted, just so they take the time to actually look through it and fill it out for you. Okay.
Yvonne, while you're still talking, there was a question that was asked. Someone wanted to know if the standard first aid with CPR, AED, and BLS, blending learning from hand to heart, would be accepted.
Actually, I think I had another student just reach out to me about that. Michelle and I think I forwarded that to you, Michelle. And I think we were going to discuss it. I think that's the way a lot of the programs are going to be going. Like I said before, the BLS and the HCP has to be done in person. But some of the programs are going to be doing the first aid like through Zoom. So I do believe we are going to be accepting it, because I think that's the way most of the providers are going.
Yeah,
So,
and I haven't responded yet because I haven't had confirmation myself, but I feel like with everything I'm hearing is everything is becoming blended now.
Yeah.
Anything that they can do online, they will do online, but there is the hands-on component, like you said, that cannot be replicated. It has to be done in person. And as long as it's that format, then it's good.
Yeah, and the blended is still very intense, because I think the program that one student is talking about, I believe the first aid is 2 7-hour classes. So it's not as if it's just some quick, you know, 3-hour class. I believe it's over a Saturday and a Sunday. I think one day is 7 hours and one day is 8 hours. And then you go back for your, I think then you go back for 5 to 6 hours for your BLS. So if anybody has any questions, or if they end up finding a program, please feel free to email me and I can look into it for you. I would just hate for you to go ahead and get the wrong one or sign up for the wrong one. So if you have any doubts or any questions, email me and I can look into it, just to make sure that you're actually enrolled in something that's going to be accepted.
Did you want to put your email in the chat box there, Yvonne, please?
Yeah.
Thanks.
All right, I just want to say, I saw a question regarding the CDS. They want to know where it's been submitted. I have the link to show you all the different ways that you could submit your CDS form to the college. You can do it by mail, you could do it by drop off. preferably not drop off right now at this time, but mail. You can also, I believe you can fax it in as well. So let me get that link to you so you can have that information, Olivia. 1 second.
Nathan, there is a drop box at the Applied Health Institute entrance right at the door. So you don't.
Okay, perfect.
Right, Yvonne, is it still there?
Yep, it's right at the door. And I just wanted to clarify, they're not accepting any faxes for CDS documentation.
Okay.
So everything has to be mailed in or placed in the Dropbox.
I think, Nathan, we ran into that last year. I think it does say something about fax on the website, but it's actually incorrect because Yvonne actually reached out to them and they said no fax.
Okay.
So I think that just needs clarification maybe on the website.
Yes. So the link is there. So it shows you the address as well that you can have it mail into. And now you know where the Dropbox is located as well. So that one is all done. So Courtney, for the information regarding different countries, you would have to kind of, I correct me if I'm wrong with everyone here, you would have to go to that website in that country. You will find the board with the registered board in that country and figure out what their standards are from there and move forward from there.
I was just typing that to Courtney. Basically, again, dental assisting is a little bit different than dental hygiene. In Ontario, it's not a regulated health profession. Throughout Canada, most of the other provinces are regulated. So you have to pass the NDAEB exam to be able to practice dental assisting within those provinces. As for other countries, they may have different rules and regulations depending on whether the DAs are regulated or not within that country. So you'd kind of have to pick the country you're interested in finding out about and research what they require.
Thank you, Jen. Let me, so Adriana, 1 second, I'll get you the link for the parking information. Okay, so for students, if you're just buying the 2 terms, it's gonna be $310. And if you're buying for the 4-month or 1 semester, it's gonna be $200, and a 1 month permit is going to be $70. I will send all this information right now so you can have it, so you can look at it for yourself.
I think too, depending on how much time they're spending on campus, like for instance, a dental hygiene senior student might only be on campus 2-3 times a week now because they're doing remote learning with their theory courses. It might not be worth it to purchase a parking pass if you're only on campus 2 or 3 times a week. So you just have to break it down to make sure you're not spending more money by getting a pass. But with that too, you don't have to go on honk every day on the app to get to pay for parking. So it is a convenience in that sense, but just make sure that, or the dental office administration, for instance, the term 1, a parking pass might not be your best bet. So make sure before you purchase the parking pass that you know exactly what you're going to be doing on campus.
Yeah, and they also had quite a few students that have been carpooling together also just to try and save some money that way. I don't know if that would be beneficial, but that's something they have been doing.
Okay, I was just about to say, Yvonne, there's a question that just came on. I think you might be able to answer. It's just that the student name is Sarah. She's currently living out the province and she'll be moving back in July to start a dental hygiene program this fall. She wanted to know, would it be acceptable to complete a CDS via Skype appointment with her doctor, or do they both need to sign it? She just wants to know how would that look for her since she's out of the province and won't be moving back until July.
Michelle, I'm not too sure. I think she'll need signatures from her doctor. I know on the CDS form there has to be signatures done. But she can. I'm just wondering if she can even go to a clinic to get all this done. Like, I don't think she has to worry about going to see her own doctor. And I think
it doesn't have to be your family doctor.
Yeah, it doesn't have to be your family doctor. And then if they need any of her history, wherever she goes, whether it be a walk-in clinic, I'm sure they can just call her doctor's office and get the information. So we have a lot of students who who move here and they don't have a family doctor and they just go to a clinic and they get everything done there. So
I think the concern for her is the timeline, which I understand, but if that's the case,
Mhm.
then I would go contact somebody immediately, or whether it be a walk-in clinic, and you might have to get some blood work done, and then they can do it through blood work to make sure that you have your varicella, to make sure that you're good for Hep B. So it could be done that way, because you don't want to risk coming and even getting, even if you get it in 2 days late or whatever, and then all of a sudden you need something done like that, then that will forfeit your spot, right? So if you can even contact your doctor to find out what they can do for you, that might be a good plan.
yes, I agree. I think, like I said, if it's easier for her to just go to a walk-in clinic and get it done, I think maybe that, that might be easier as well.
All right. Well, thank you, everybody. We have reached the end of this session. Thank you so much for joining us. Thank you for taking the time, all faculty and staff. And we thank you, new and potential students, for taking the time out to learn a little bit more about our dental options at Niagara College. Besides that, you all have a wonderful day, and we'll talk to you soon.
Thank you. Thank you,
Thank
Paul Kelly, too, for being online.
Thank you. Have a
Yes.
good
Thank you
day.
for everybody who joined in today as well.
Thanks for
Hi,
having me, guys.
everybody.
See you in September.